see here. Alright, so I think this will be alright. So for those of you who don't know me, my name is Britt. I am a nurse. I work in a trauma ICU, and I am 10 months on testosterone. So what I'm going to do is I'm going to do my shot, which is subcutaneous, and then I'm going to do just a little bit more information about IM injections, because I know a lot of folks do IM injections. So we'll start with this. So I get a 4-pack of these. It's just the way my provider prescribes them. So they're these little like multi-use vials. Some folks get like a single dose vial. So technically you're not supposed to put a needle in this more than one time. But I believe, I want to see if this says it on here. Some of them will say single dose versus multi-dose. This one just says sterile vial. They're all sterile. So I'm going to use a new one because I actually was out. So, and actually, so I want to show you the difference. The boxes look a little bit different. Don't be concerned when you see this. So when you see 2 different types of boxes, it's just different companies. So if you look, you can actually see that they both say testosterone. I don't even know if I know how to pronounce that. Cypionate. Anyway, they're the exact same thing. So don't be concerned about that. So I have my little vial here. I have 2 alcohol pads, and I'll show you why I have 2. I have, so for me, this is this is the one I'm going to draw up with. It's a 20 gauge 1 inch. So little thing to know about these are that the larger the gauge, the smaller the needle. So, and it doesn't make any sense. It just doesn't make any sense. So you can draw up with a 20 gauge, and the reason that you do that is because the needle that you inject with is just not going to be large enough, because this is actually pretty thick. Testosterone is pretty thick. So I have my 20 gauge to draw up, and then for me, because I do subcutaneous, I do the 25 gauge 5/8 needles, so 5/8 of an inch. And I'll show you, you can see it. It's little, that's why I like it. So when I went to start on testosterone, I went to Planned Parenthood, and I said outright, like, I'm not gonna give myself an IM injection, and they said okay. So that's why I do subcutaneous, just it's preference. And then I have my syringe here. So the differences between these syringes, and actually I bought these online. I bought these 25 gauge 5/8. I bought them online. I got 100 of them for $5. So you can get these probably cheaper than a pharmacy will charge you for it, or insurance or something like that. I actually don't go through insurance for my testosterone because my insurance was only giving me 1 of these vials a month, which lasts like 2 weeks. So I was having to call my provider every week. So the other thing just to note, if you are going to use these or buy them online, make sure that you note, I'll show you. These are called a lower lock syringe, so they have a little locking mechanism on them, but there are also slip tip ones, and the slip tip ones actually fit onto this one as well. You can see it's got that little little bevel thingy in here, so you can slip it on the top. Mine actually lock in. I just like them better, so that's why I get those. So I have all my stuff. I have my syringe, I have my 2 needles, I have my testosterone, and a Band-Aid. Because I do subcutaneous, I don't bleed really, because you're poking fat. You're not poking any muscle or anything like that. I'm sure when you do IM, if you get, blood back, it's not a big deal, but we'll go over that after. So, something to note about these guys. So technically, these are sterile. So what's underneath here when you pop it off is technically sterile, but I always, and I would really just recommend this is just what I do at work, this is just the practice that I've started doing, just scrub the hub. It can't hurt, just scrub it. So I just kind of do it for a little bit. Some people literally will just do that and they're done. I have more OCD than that. So, and then what I'll do is I'll literally just, and this is what I do at work, like I'm not changing what I'm doing for this. I just leave it on there. So, I can't remember which side I did, so I do my sides here. Some folks will do their belly. You can do, so it depends really. You can use the back of your arms, but it's hard because you have to be able to do this, and the second you do this, you're flexing, and you don't want to get the muscle, because we're not doing an IM injection, we're doing subcutaneous, which is a fat. Essentially, you're just injecting into your fat. So I have the most fat right here, so that's why I use this spot. There are spots you can use on your thigh. You can use your belly. Some people use their belly. I don't want to, so I don't. I could absolutely go like this and inject into my belly, and you would just hold it like this. Obviously, you don't want to let go. But I just don't. I much prefer here. I have more fat on my sides here, so it just makes me more comfortable. So anyway, here we go. Just screw this bad boy on here. This is my 20 gauge. This is my larger needle. Take that off. And so what also some people do is they'll draw up the amount of air that they're going to bring back. I don't do that. I find that I end up getting air bubbles anyway, so I don't do that to myself. There's no need. So let's see make sure you can see. So I actually do 0.4. So when I draw back, and at first when I draw back, I'm literally just getting air. You can just see like a little bit going in there. So I'll just push the air back in. You really want to get the least amount of bubbles as possible. So if I can try and get my bubbles out, I'm going to. I have one bubble that's being stubborn. Okay, here we go. So I want to show you also what I do here. So I actually pull back. So one time I did an experiment because I was really curious how much testosterone I was leaving in this needle. This is 1 inch, so you can imagine that you're leaving a fair amount. I actually did an experiment and saw that I leave in a 1 inch needle about 0.5. So I didn't want to waste that because I was just going into my thing here. So what I do is I actually draw up to 0.35. I take this off, and then I draw back the rest from the needle to 0.4. That way I get my testosterone back. So then I'm just going to switch these up here, and then we'll talk about IM stuff. So a lot of people I've talked to or asked questions about is how is IM versus subcutaneous different? There is no current research saying that one is absorbed differently. And actually, if you look on this, and when I went to the pharmacy, they were really confused when my provider wrote for the smaller syringes, because it says it's for IM use only. It's not. There's actually no current research that says that it's absorbed differently, or that you have different effects than others. Obviously, you have there are patches now. There's folks that use the cream. I believe they have pellets, but I have a feeling that insurance is a bear for something like that. There's really no research. For me, I was I don't want to give myself an IM injection, so please give me a subcutaneous, and that wasn't a problem. Some providers might say that it's only used for IM. It's not true. If you look on the University of San Francisco website, you'll see that there's no evidence, there's no information saying that one is better than the other, it's going to be absorbed any differently. So I'd much rather use one of these bad boys, because, sorry, if you don't like needles, you can turn away. It's smaller. It's a lot smaller, and I much prefer that. So what I'll do is I don't remember which side I use, so I'm just going to use this one. Get my Band-Aid at the ready. So I just use, is it Depot? Oh, no. So this is, I'll show you, the testosterone cryoptonate. I can't pronounce it. But it's just what my provider prescribed, and that's what I stick to. If you use that, then have at it. Just stick with the same thing as that would be what my... So, when you do subcutaneous, you gotta find that subcutaneous fat. That's all it is, it's fat. Find yourself some fat. So, I have plenty over here. So that's what I use. So for subcutaneous injections, so here, I see a lot of people do this. They take their thing and they just go like that, and that's it. Don't do that. Do this. Just find yourself a good spot. Make sure it's nice and clean, because really at the end of the day, the last thing you want is an infection, and all it takes is a few more seconds of doing that. Just do it. I'm just going to do this because it's really annoying. Okay, so as this is drying, I'm just going to push the testosterone into the needle, because if not, whatever's in the needle is just air, and that is not going to feel good. I promise you, it's not going to feel good. When you get air into that space, whether it be IM or sub-Q, it's gonna hurt. It's gonna feel like you have a bubble under there. It's gonna, it'll burn, and then you feel like you have to massage it out. I don't know if anyone's ever experienced that before, but I have. So I'm just gonna put, and I do it really slow because I don't want to lose any. No. So I just do it until I can see it at the bevel, which is the top here. I don't know if you can see that, but so you just grab hold, and then the difference between doing subcutaneous and doing IM is that IM you go 90 degrees, so you have your spot and you go straight in. With subcutaneous you actually go 45 degrees because you're trying to avoid that muscle. I have fat here, but you know. Alright, so I'm going to go on a little bit of an angle, and honestly, I know a lot of people they get really freaked out and and they can't just get themselves to do it. You're better off just like a dart. You won't even feel it, I promise. That's what I do to my patients, and you just count to 3 or whatever you gotta do, deep breath in and just do it. I just do it. And then so with it's a thick substance, so it's gonna take a little while to go in, which is fine. Totally normal. I actually just realized as I was doing this that I think I did this side last week. It's fine. So then you can release. And hold on. That's it. That's it. Oh. Just put your little Band-Aid on there. And then you can, if you want, like some people do this. You don't have to. It doesn't. The thing is, the difference between this and IM is like if you put it in your muscle and then you're like walking around, obviously your muscle is moving and it's moving the fluid around. Mine is sitting in my thigh, so I'm just gonna move it around. And you can. It's not a big deal. It's easy. Put my clothes back on. So hopefully also you have a proper place to store this. You get one at CVS. So the difference is, you know what, I think I should have grabbed. So if you do an IM injection, there are a bunch of places you can do it. If you've ever gotten a flu shot, they do it in your arm every time. The only reason that no providers really tell you to do that is because you can't really get your arm yourself. That would be really hard. So, I do have they're not old needles, but they're needles that I used to use because my pharmacy didn't have 5/8 inch, so they would give me an inch, so I'd have to only put it in halfway. That was a real pain in the butt. So what I hear often about IM injections is that the provider will order 1.5 inch needles. Typically you would use a 1 inch needle. That's gonna be the best. But if you get 1.5, you just deal with it, just like I did. So they're probably you're gonna have one just like this, which was my 20 gauge 1 inch to draw, and then you're gonna have probably like a 25 gauge, 24, 25 gauge is ideal because you don't want to put anything bigger than that into your muscle. It would not feel good. And so you're gonna do the same drawing up process. It's gonna be the exact same thing. You're gonna draw up with this one, and then you're gonna switch it off for your thinner needle. Definitely the thinner one. So again, the higher the gauge number, where did it go? The higher the gauge number, the smaller the needle. So this is a 20 gauge, it's a thicker needle. It's opposite of what you would think. So other spots you can use, a lot of folks use their thigh and they say that it hurts. They say that they want to switch it up. You can switch it up. You can use your glute. When I see other people's videos, it makes me cringe just a little bit because it's not, you have to be really careful with your glute because you don't actually use like your main glute muscle, like your gluteus maximus, which is like the big meat of it. You actually use your medius because your maximus has a very thick nerve that runs down it, and it runs down like the middle. It starts in the middle because it literally, like, trying to figure out a way to explain this, but it like kind of pops out from underneath and then runs down, and it's very sizable. So you want to avoid that. So you definitely don't want to use like any of this here. You would use up in here. So we can talk about your thigh first and placement on that, because what I also see all the time is people do it on the side of their thigh. You don't want to do that, and I'll tell you why. So I'm gonna put you on this chair so you can see my leg. Maybe you can see my leg. Maybe. Okay, so to find the perfect spot on your thigh. So I'm really pasty. Sorry. So the first thing that you're gonna do is, can you see my knee? So you're gonna take one hand. So say we're using our right leg today. Take your left hand, and I want you to cover up like you're gonna turn it sideways. So the bottom of your hand here is gonna be over your knee. We're gonna avoid all of this spot because when your quads come down, they actually come down and attach to your knee. We don't wanna inject in any of those spots. So you're gonna cover this up here. You're gonna take your heel, you're gonna put it in the crease of your hip, and I want you to make like a 5 hand. And you're gonna go like this. Now, what I see people doing is they inject on the side here. So you can, people obviously are, but the problem with that is that you actually have a very wide piece of fascia that runs from your hip down to your knee. And fascia is really inflexible, it's tough, and if you ever have done a stretch like this and you lean, you'll feel how tight it is. It's tight. So to get to this muscle, people are injecting through the fascia, and it could cause more pain than you really need. So we have our hand down here, we have our hand up here, and then you have that 5 hand, and then you're literally gonna go right in here. So like basically this is really hard to show. Harder than I thought it was gonna be. So you're going to aim in between your middle finger and your ring finger. So if I don't know if I have strong enough legs for this, but if I flex, you can see there's like, so your quads, there's outside muscle here. This is the biggest one, which is why you're supposed to use this one. This is a small one and also like terminates a little bit earlier. And then you have one in the middle, and that's the other place I see people use. And the only problem with that is that it's small and it actually dips down pretty early and attaches to your knee. And then these muscles kind of they kind of like come up this way. So it's just a really narrow space to use, and it's a smaller quad muscle. That's why using this one is the best. And if you, depending on, your musculature, I have really skinny legs, but you can see it here. This is the one you want to use. It's big, and so you make that 5 hand, and you're gonna go right in here. So you can see that like your area is small because you're kind of staying right in here. You're just kind of staying here. But it'll probably hurt less if you use that big muscle. I really wouldn't recommend jabbing through a big piece of fascia like that. That's gonna hurt. And so another thing that I know people do and I think it's just out of fear, and I totally understand that, because you have this needle that you're staring at, and you have to, your brain is telling you, please don't do that, and you're like, no, I gotta do this. So I'm just gonna demonstrate, but I'm not gonna poke myself, obviously. I have the plastic on it. So you're gonna find your spot, and what I would really recommend is if you can get like a chair or something like that where your leg is like kind of hanging off. So like I want you to have your leg really relaxed. Don't have any tension on your muscle, because the tension is gonna make it harder to penetrate the muscle, because you're doing, you're like this. So I'm just gonna do this so you can see it, but ideally you'd really, let's see if you can see it if I do this and sit on this chair. Maybe not. Maybe not. So like this is actually like a bar top stool, so I can like swing my leg, and my leg can be really relaxed, and you can find that spot. So you can like have your hand here, you have your 5 hand here, and you're gonna find your spot, And you can, if you want, you can flex for a second and be like, okay, I'm going right there. That's where I'm going. But then relax the muscle. Just relax it as best as you can. If it's, no, this isn't, you can't see, but this isn't the best. It would be like relaxed, like underneath your knee here, honestly, because that's how I'm taking all the weight off of my quad, and I'm not going to use it. Putting top hand over the knee and the knee area under palm. Oh, like with this hand, you're doing that? I'm curious. So relaxing that quad. I think you can sort of see. So I'm relaxing. Yeah. So relaxing that leg, because you don't want any tension on the muscle that you're going to inject in. Let's see. Oh, like another palm, like that. Oh. Sorry, yawns. Yeah. So, you can do that, but if you're doing this, then you're giving yourself like all that space, right? Like, you're saying that essentially you could poke anywhere in this region, and no, you're fine. You're fine. No, because I bet you a lot of folks do that. So some people will do this and this, so you're gonna stay in this area, but you want to make sure that you stay on this vastus lateralis muscle. This is your big one when you go walking and things like that. You go to the gym. This is the one that's gonna move that fluid around for you. It's the big one, so that's the one that I would suggest. So try to relax that quad. And I see people do this, and it looks so painful, and I would never do this to one of my patients because it just would be mean. So a lot of folks, I see them, so they grab their muscle, they're all ready to go, and they do this really slow injection. So when you do a slow IM injection, so when I was in nursing school, we had to give each other our flu shots that year, which was probably not a good idea. And I watched someone give someone an IM injection, and she got nervous, and she went like this, and she just did like a tiny little poke, and then she slowly pushed the needle in. And sorry, it's my puppy dog. And that is, if I can stress it enough, or give you the strength enough to make it worth it to just do like just a dart, that would be reason enough, because it will hurt a lot less. If you can do, like, find your spot, you have your alcohol pad, the whole thing, do exactly what I did, where you're gonna get, put the testosterone in the needle, because you don't want to inject any air. And you literally just do you can do like a 1, 2, 3, you can do a whatever, but I definitely absolutely recommend just like right in. Because if you can in one shot get that needle in, I can almost guarantee you it's not going to hurt nearly as much. Because I see people all the time, they'll put it in and then they slowly push it in. That's so painful. That's so painful. I had someone do that to me once, and that was really bad. It was a bad flu shot at a pharmacy. So like a 1, 2, 3 in kind of a thing is going to be best. I also had someone else say to me recently that apparently, I didn't know this was a thing, folks will draw up and then they'll keep a bubble at the bottom so that when you inject, you don't lose what's in the needle. So you're injecting, and you can push anything that's left in the needle in. Because, yeah, I probably left some testosterone in here, but I'm okay with that. It's never been a practice in nursing to use bubbles. When I give IM injections at work, there's a little bit left in the needle, and that's it. It's just the way it is. There's no, I really would strongly discourage a bubble, because you don't want to inject the bubble. It's going to hurt. It'll leave like a residual pain. No air bubbles. I know. The air bubbles. I didn't know that people were doing that. And I was like, oh no. I do understand that people are like really, it's hard for them to be aware that this magic in these little vials is going to waste. It's not, I promise. I feel a little bit better about it because the way I draw up, so I draw up the 0.35 and then I'll pull the rest out of the syringe. I feel better about that. So please don't do the air bubbles. Okay, so you can also use your glute. So if you're comfortable with your thigh and you're comfortable with your glute, then you have like 4 weeks of shots right there, which is really awesome because then you're constantly switching up the spot. You definitely always want to switch up the spot. So this one is going to be interesting for me to show because I have to do one of these. So if you want to use your glute, so it's actually not far from what I was doing here, but obviously the needle is going to be longer and you're going to go for your muscle. So my hip bone, so you're going to find your hip bone, and unfortunately I can't, ideally, oh, I think I have a picture. I might have a picture that's probably going to be more helpful than me trying to like break my arm to do this. So, and it's fuzzy, but I'm going to show you. So, ta-da! So this is how you find your spot. So you can put your hand, there's a few ways that we can do this, and you can like double check it in a few different ways. This is the front side of, oh, my bad. Oh no, breaking stuff. I shouldn't be allowed to touch technology. Alright, so you can see this is like the front side of the person, so it's like me, front side. And you're gonna have your thumb facing the front side, which is why I can't do this because I don't bend that way. Ooh, maybe I can do this so you can see both. Oh my god. Maybe not. It may fall off the table. So this is the front side of me. So technically this is backwards, but I had my wife, if you have someone that helps you with your shot or does your shot, that would be really helpful, at least so you can find your spot, and then over time you won't need the hand anymore. You'll just like know where to go. So one thing you can do that helped me find this spot is actually if you lay on your side and you feel, so you have like your hip bone here, this is my hip bone. If you feel under it like this and you lift, it's like you like lift your leg out to the side, you can actually feel your gluteus medius engage, and you can be like, oh, okay, awesome, like right there, that's where I can go. You don't want to go anywhere in this region. That's where your sciatic nerve is. Don't inject there. So you want to stay more so in here. So technically your thumb is going to be someone's thumb. Someone's thumb is going to be forward because who can bend that way? And you're going to have your hands like do that 5 thing again. And you're going to go for your index finger and your middle finger here. So you're gonna go in between. And when you find, if I can bend that way, when you find the spot, you can always check it. So if you can feel your hip bone, you wanna go like, I would say like a finger below that. So make sure because you don't want to hit your bone. Make sure you go like a finger below that before you put your hand here so that you're far away from your little iliac crest here. So like your hip bone has like a ridge around it, and this is my ridge. So say I do this and I take like this part of my finger just so I can separate myself from the hip bone and the meat. Oh my god, I look absurd. Okay. So you're gonna do like one of these guys. And honestly, kind of where I did my injection, I would go a little bit lower. So if you like see my band-aid, here's my hip bone. If we do a finger, I can send anyone this image too if it's helpful, or you can Google it. That's how I found it, so I could show you. So this is where I did my injection. Honestly, if I were doing an IM, I'd probably go right under that. I would probably go right under that, because if I go like this, if I go like this and lift my leg up, so like on an angle backwards, I can feel my gluten gauge. And if you can feel your gluten gauge, and I can feel it right here, I would go right here. So right around here. I wouldn't necessarily, let me see if my other image is, I'm just trying to make it a little bit more so you can see like what I'm talking about. Oh yeah, here we go. So that is your sciatic nerve. We want to avoid that. Don't go near that. That's your gluteus medius. So that's what I'm talking about when I lift my leg up backwards. I can feel that engage. This is your maximus here, so the muscle goes that direction. You want to go up there. So it's if you see that little like moon-shaped thing, that's your iliac crest. So that's the ridge of your hip bone. And then you're going to go under that. So make sure you're like at least an inch under that and not too far in here. So you don't want to be in like right lateral, because that IT band that I was telling you about, it's right there. So the thing is that, let me see, I think you can actually see it in this image. The IT band. This lighting is not so great, but I want to just kind of stress the IT band because it's a really thick piece of fascia right here, and it runs from up here down there. You do have your quad muscle under that, but I feel like to try and penetrate something so thick and immovable isn't worth it. It's not worth the pain when you could find that spot on your quad a little bit better. So I do see people use their top of your quad. You can do that. I just wouldn't. I would use the bigger muscle. That's the one you're going to be using when you're walking. It's your main go-to there. So I would not do that. I don't know if people do that because I just see videos. I don't know if people do that because they're trying to switch up like the spot. But if you can, like the thing is that I use this side and then I use this side. I just go back and forth, although apparently I just did this side twice in a week, or in 2 weeks. As long as you're switching it up, you don't need to like switch up the spots on your quad. But I know that I am, so you can use, like, technically you can use your arm too if you have someone else doing it, but honestly I wouldn't want to if I were you, because if you've ever gotten a flu shot and like for the next few days you're like, oh my gosh, and you like can't lift your arm up, like you don't want to do that to yourself all the time. It's just not enjoyable. So like the main spots, and this is why they, hopefully the nurse at the, I mean, typically the nurse is the one to do the trainings for the shots, but I know some providers do. I've actually had a friend of mine tell me that his provider told him it wasn't important to scrub the hub before he injected. It is really important, because the thing is that once that cap is off, once this like sterile cap is off, once you pop that off, I just put it in the box. It's not clean. Definitely scrub the hub. Technically in nursing, you're supposed to scrub the hub for 10 seconds. I'll usually do that, and then I leave it on. Like if I'm at work and I draw blood cultures and stuff like that, it's actually practice to scrub the hub for 30 seconds, and then you have to leave the pad on top so that there's no way of like any bacteria or anything like that, dust, sneezes, anything like that getting on the top of it. But that stuff is, you know, I know that that's not common practice for non-medical people. It just is for me, so that's what I do, and that's what I like. It makes me feel better, you know, because you don't want an infection. That's just not worth it. It'll be worth the extra 20 seconds. So if you can, or you are up for, you know, using one thigh, then the other thigh, and then a glute each week, then you have 4 weeks there where you're switching it up, and I feel like that's pretty good. I don't know, I'm trying to think if, no one's ever said to me, like, when they do an IM injection, if, yeah, of course, anytime. If there's anything like what about it is painful, if it's just the injection, it could be the way you're doing it. If you're nervous about doing it and you hesitate, that's not going to feel so good. Oh, another thing that I don't know if providers or nurses or who's teaching your injection, but I know some people will say that you should, that when you do an IM injection, when you inject it, some people will say you have to aspirate, which means that you have to, like, so the needle, you do the injection, the needle's in, say, your thigh. Some people will say you have to pull back on the plunger a little bit before to make sure you're not in a vessel. That's actually not, you don't have to do that. It's not practice anymore. I've never aspirated before I did an IM injection. When I was in nursing school, they said that we don't do that anymore. It doesn't do anything, it doesn't really mean anything, you can just do the injection. So you don't have to do that if you do it, or if it makes you feel better, you can. I'm trying to think what else that I might have missed. I'm going to try to save this video, and I'm going to put it up on my YouTube so people can see, and then if you want to ask me questions later, then you can ask me questions. You can message me. I'm going to try to come up with like different healthcare related topics for queer and trans folks every week, so that I can give some more information, because I know that there is, and from my experience, I've had really awful healthcare experiences, and it has been me educating myself and reading up on what I should be getting, I've also gone to a few different trans health conferences and things like that so that I can have the information. But a lot of the information that I find is geared towards healthcare providers, so it's really hard for someone who's not in the field to know what it means because it's in like medical speak. So I really want to break that stuff down. I've read the University of San Francisco has a trans health website. It's fantastic. It's the Bible, but it's geared toward healthcare providers, so you have to be able to understand it. My experience with my primary care has been me essentially gently telling them what to do. Because, you have to be careful, as we all know, and you don't want to alienate anyone because you need to get what you need to get from them. But I've spent a lot of time, I had my primary care, so I had been on testosterone for 7 months at the time, I think, and I was still getting my period, and I told my provider because I was like, maybe I need to increase my dose, but I'm not really sure, and I thought back to how many times I had changed my dose, and technically when you are on a dose you should be on it for at least 3 months and then have your levels checked again, which is why your levels should be checked at so some providers will take like initial levels and then they'll start you on a dose, and technically they should check at 3 months, 6 months, 12 months, and then once you get to that year, if everything's okay, your levels are within the range that they want them to be in, you can actually just check once a year, and you just check the testosterone level. They'll also check the hemoglobin level, and this is actually for transmasculine folks. I have different information for trans feminine folks if you need it. My provider had said to me, well, we should start you on progesterone to stop my period. That is so wrong. They actually give progesterone for cis women as birth control and for trans feminine women. So it makes no sense that I would be taking testosterone and progesterone. There is no practice that states that that's correct. So in an attempt to not alienate my provider, I basically just said I'm not going to do that right now because I had only been on 0.4 for a month. So I was like, I'm just going to give it more time. And I did. And it was fine. So if there's any information like that you need, I can look it up for you. If I don't already know, I've done a lot of research on obviously like testosterone and things like that, and dosing and everything. So I know a lot about that. But if I don't know it, I'm gonna find out for you. I have a lot of folks that I know that work in directly with trans folks and more so are providers and prescribing. I can't do that as a nurse. I can't prescribe. But I can give you the information that I have. I'm allowed to do that. I can't diagnose. So everything all the information that I'll give you is going to be within my scope. I'm going to obviously stay within my scope. I can't diagnose anyone, but what I can do is give you the information, and you can give it to your provider and say, like, the way I suggest like wording it sometimes is like you could just be like, kind of play dumb and just be like, oh yeah, I don't know, my friend gave me this information, I just like figured, have you seen it, something like that, like just kind of, because most providers, at least where I live in upstate New York, I live like 15 minutes from Lake Ontario, they don't know I don't even think they know about the University of San Francisco website, because it is the most basic thing to prescribe testosterone. primary care can do it. So an MD, a DO, an NP, or a PA can all prescribe. You do not need to see an endocrinologist to get prescribed testosterone. If they tell you that, they're lying. Because that's what my provider told me, and I knew she was lying, and I found out she was lying. So I stopped going to her, and that's how I ended up at Planned Parenthood. But depending on where you live, you may or may not have more access to some much better health care. Like if you live in Boston, you can go to Fenway Health, and they just like are way better than anything I've experienced here. But yeah, like if you have anything else you want me to talk about or address, I can definitely do that in the next week or anything like that. If not, I'll just kind of like come up with topics that we can talk about. And you can always get yourself a really fun bag for your testosterone. I see some like really cool, Stealth Bros has something similar to this, which is really cool. This one's made out of like old bike rubber, and I got it from an awesome friend here. And yeah, so I'm gonna try and post it. I don't know if I can post it on Instagram, but I'm gonna try it because it's long. I'm gonna post it on my YouTube, and if it doesn't work, I'll just make a separate video of me doing a similar thing and maybe not going on this rant that I just went on, and I'll put it on YouTube. So if you have any questions, feel free to message me. I want to give you all information because there is so much information that's not being given to the trans community about healthcare and what you deserve, and educating providers and things like that, because unfortunately we do have to be the educators right now. We have to be the ones to give them the information to know how to treat us. It's not ideal, but it is the way it is right now, or at least for me. I know some other folks maybe have some better experiences than I have here in Rochester, New York. So yeah, so I appreciate people watching, and I hope it's helpful. And let me know if you need any like follow-up. Yeah, of course. If you have any hey Kai, follow-up questions or anything like that, or I can show you some more stuff, some more injection stuff. But my word to the wise is just do a real quick injection. I do know some folks get really anxious before their shot and things like that. Like, just find your way to decrease that anxiety by just like whether it's like turn on some chill music, or you have like an infuser going of lavender oils. I don't know, whatever you gotta do to relax before you do it, and just like a quick dart shot. That's going to be the least painful way to do it. So that's my 2 cents on that. Anyway, I'm all done. I don't have anything else to say. So I'll just post this on YouTube, and you can just like let folks know that it's there as a resource if anyone needs it. But thank you for watching.